Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not for the best OET sample videos. You will find the reading, writing, speaking, listening, all of the material on this YouTube channel, and I assure you for the best guidance as we have been teaching since last 11 years and being the only institute run by doctors, we assure you for the best OET services. Our contact number is 76967 34256. I would repeat 76967 34256. Now I'm going to take you to the speaking session in original what happens. So in speaking there are few points I would like to cover very quickly. First and the major point for all the new people, like for the new candidates who are learning about speaking, first of all, there is no marks for facial expressions. So that means you don't have to worry. You can see the whole topic, and that is how you can speak. Means you can look at your topic, you can write on your topic. You will get 3 minutes to prepare. So 3 minutes to prepare and 5 minutes to speak. And the most important point about this 5 minute speaking is that 90%, I would say 80 to 90% of the times, examiners or interlocutor is very, very passive. Passive means he does not participate. That means he is very reluctant. So when the examiner is reluctant, it becomes very difficult to carry your role play for 5 minutes. But if you will develop this ability like me of talking for 5 minutes, you will be doing exceptionally well. In OET speaking, as I have just told you that facial expressions has no marks. That means it is very important to speak continuously the way I am speaking right now. At the same time, it is important to engage the patient by asking, are you understanding my point? Is everything clear to you? Should I repeat anything for you? So these are the most important line when it comes to OET speaking. OET speaking is not a difficult task at all. The major thing that OET speaking is all about is to engage the patient and is to make the patient satisfied. So it's not about that topic which you see. So most of the times we are lost in the medical topic, but OET speaking is majorly about satisfying the patient. If the patient is not feeling happy, then you say, don't worry, we are here for you. Please calm down, relax. Calm down word you say when patient is angry. Oh my God, nurse, what did you do with me? Please calm down and relax. Doctor has operated you, and because of that operation, you are out of danger. So please don't worry, you are in safe hands. So these are the important points about OET. Sometimes patient blames you. He says you did something wrong. So you explain it, there is nothing like that. So these are the special lines of OET. There is nothing like that. Please try and understand. Please cooperate. You don't have to speak all these lines all together. It is according to the situation. When patient says, oh, you did something wrong. No, there is nothing like that. Please try and understand. We did everything for your benefit, and let me explain you each and everything in detail. So try to explain the patient in detail and develop a habit of talking, standing in front of mirror and talking for 5 minutes like the way I'm talking to you right now. So you have to develop and inculcate this habit. And apart from this, you can talk about various things like, okay, have you understood everything? Should I repeat anything for you? Okay, am I clear? uh, do you want me to explain you anything else? So these are the simple lines of OET that makes you perfect. Let me take you to a topic. I have not read about that topic. So as usual, I will try to execute it in front of you. So like yourself, I do not have any clue about this topic, what this topic is all about. Suppose if I get this role play in the exam, I will have 3 minutes to prepare. So my 3 minutes start now. Emergency department. You are a nurse in the emergency department of a public hospital. Public hospital means of a government hospital. So obviously public hospitals are normally busy. That generally I think that emergency department of public hospitals are busy. You are short staff and the available doctors are dealing with the patients on a critical priority basis. That means doctors are dealing with the patients according to their critical, according to how critical the patient is. So the topic is about, so obviously I can understand even without reading that this topic is majorly about how to handle the patient, how to handle the patient when doctor is busy. So in this most of the times you will say, please calm down, please relax, we are here to help you, doctor is coming soon. So I try to remember all these lines, and also with my pencil on the role play card I will write it. Don't worry, we are here to help you, doctor will be coming soon, there is nothing to worry. So I will automatically write line like these. Then I will see the role play. An aggressive patient, a person who has obviously been drinking, has demanded a doctor see their mate with a suspected broken arm immediately. So that means that person is pushing you to see his friend who might have a fracture or a broken arm, and they are drunk. So this is the main role play. This kind of a role play can be very difficult in the exam to handle, because the examiner or the interlocutor would be like, I don't care, nurse, I want the doctor. So you say, please relax and calm down. This is professionalism. Please be assertive. Please calm down and relax. We are here to help you only. So before I can call the doctor, I need to examine you. So these are the simple things which can make you feel very light. Then first of all, the role play. What Let's see what are the tasks. Introduce yourself, explain your role. So you will say, good morning, my name is Bhupesh and I am a nurse over here. I am here to attend you in the emergency department. So could you please tell me how may I help you? So this is the thing that you will say when it comes to emergency department. How may I help you? Acknowledge their concern for their mate and ask for the details. Acknowledge means that, acknowledge is a kind of a word you use, that okay, I have understood. Acknowledge means okay, I have understood. So okay, so you acknowledge. Then the friend will say, you know that my friend is having this and this problem. So you say, okay, I have understood your concern that your mate might be having a fracture. So please tell me how did it happen. Then he will explain everything, that we were drinking, this and that happened. Then you say, don't worry, a nurse has reviewed your friend and they will be seen as soon as possible. So don't worry, a nurse has already reviewed your friend and there is nothing to worry, and doctor will be here very soon. So you just say this thing, doctor will be here very soon. Then the next point is, explain that the patient are seen in order of medical priority, not arrival time. So obviously this you cannot speak yourself. This patient will say, oh nurse, I have been here for half an hour, you are not attending my friend, why are you doing so? So you will explain that, please try and understand that patients are seen in the emergency department according to their medical priorities. That means how critical they are. Suppose if some, because this is an emergency department, some people are fighting for their lives, they are in the stage of dying, so attending those patients become more important. So it is according to the severity of the cases that we attend the patient, it is not according to the arrival time. As a nurse has already reviewed your friend and your friend is completely out of danger, so there is nothing to worry. Doctor has already been informed. Doctor has already been informed. There is nothing to worry. These are the repetitive lines that you need to use in these kind of role plays. Let the person know he is disturbing other patients. So maybe he will be making lot of noise. Oh nurse, you are wasting my time. This and this, you are not attending my friend. So you need to say, please understand that this is an emergency department, and by speaking loudly or by making lot of noise, you are disturbing other patients. So I'm really sorry to say this. This line is very important. I'm really sorry to say this, but you need to keep quiet for some time, because this is an emergency department. People or the patients are already in the anxiety stage or in the critical stage. So making a noise is not good for their health. So please try and understand this is an emergency department and you need to control yourself. Okay. Advise them that the alcohol consumption intoxication is not permitted on the hospital premises. So maybe he will start drinking or something like that. So he will say, I'm sorry to say you again, but alcohol consumption and intoxication is not permitted on the hospital premises. So that means while you are in the hospital, you are absolutely not allowed to drink or to do anything like that. Are you getting my point? So this is how you ask. Suggest they make arrangements to go home. So then you can say, see, as you are already drunk and nurse has already reviewed your friend who is completely fine, his arm has not broken. This role play is not the complete role play. If it will come in the exam, this line would be given that friend does not have a fracture. So only then you can do the arrangements, or you can tell them to make the arrangements to go home. So if it comes in the final OET exam, it would be surely given that don't worry, you need to make now your friend is fine, as your friend has already been reviewed by the nurse and there is no fracture, so there is nothing to worry, you need to go home and you can take the medications like painkillers, and tomorrow you can come. Advise on the hospital security staff action in case of threatening behavior. So if he tries to threaten you, then you say, see, now in this way you are trying to threaten us, and I am really sorry to say again that, or if you don't want to say I'm sorry, then you can change this word that I'm afraid to say, then we have to call the hospital security staff and they will come, and it would not be a nice thing. So it's better that you can leave right now, as your friend is fine and is out of danger, and tomorrow you can come and can pay visit to the hospital. So all these points will be given in this role play. There are certain points which are missing, but that's okay. In exam you will get the complete role play in a very nice way. Now I will speak it for you, the complete role play again. So good morning, my name is Bhupesh. I am a nurse over here. So my role is to attend the patients over here in the emergency department. So how may I help you? Well, nurse, I am here for my friend and I think he is having broken arm. Okay, don't worry, calm down. Let me attend your friend. I will provide you one of the nurses who will review your friend. By that time, you can have a seat. You can have a seat. But can you tell me how did it happen? Oh, nurse, I was drinking with my friend, and I don't know, we went into a duel, we had a fight, and then I cannot remember. Maybe he fell down, and we suspect that he is having a fracture. Okay, so that means you were drinking, and also that your friend might have a suspected fracture. For that, I have already arranged a nurse. She is reviewing your friend. So please calm down and relax. Have a seat. Your friend is being attended. Is it all right? Yeah, nurse, but I don't know. I really want to see the doctor. Well, I understand that you want to see a doctor, but doctor is attending the patient right now. There are some critical patients in this emergency department who are fighting for their lives. So they are important to be attended by the doctors. So please calm down and relax. And your friend will be attended very shortly by the doctor. At this point of time, he is being attended by the nurse, as I have already mentioned. Well, but nurse, you are not understanding that I have been waiting here for 15 minutes. You are not understanding that my friend really needs attention. Again, I would like to repeat that your friend is being attended, and according to nurse, your friend is not having broken arm. He is completely fine and there is nothing to worry. But nurse, you are making a lie. Why don't you call the doctor? Well, please try to cooperate with us. Please try and understand the situation. By making a loud noise, you are scaring other patients and you are disturbing other patients. So it is not a good thing, because some of the patients, as I have already mentioned, are not in their conscious state. Some are semi-conscious, so they might get anxious. So you need to understand that you are standing in an emergency department, and over here, silence is the most important thing. But nurse, how can we be silent? Because this is because we are coming for an emergency over here. My friend needs urgent attention and you guys are not providing it. What can I do about it? Well, I have already told you that your friend is out of danger. There is nothing to worry. He's not having even broken arm. So at this time, I would like to just tell you that you can go back home, as your friend has already been attended. And also it is an emergency department, so we are attending other critical patients. Further, you are intoxicated, and in hospital premises, especially in the emergency department, alcohol consumption and intoxication is totally prohibited. It is not permitted at all. So please try to make arrangements to go home. Your friend has already been attended and he is completely fine. Oh my goodness, I am not gonna leave you like that. Why don't you understand? You have not attended me properly. You have not taken care of my friend properly. I'm gonna sue you. I'm not gonna spare you. Well, please do not threaten us, as if you will threaten us, we have hospital security staff and they might have to take action. So it will not be a very good thing. So I will really encourage you to go back home at the moment. and your friend, as mentioned earlier, is absolutely fine and there is nothing to worry. You can come tomorrow morning and we will attend you in a better way. So for now, it is better that you can go home, have some rest, and your friend will be fine. Okay, nurse, then I'm leaving. Okay, take care and we'll see you tomorrow morning, and take care of your friend and for yourself. Okay, done. In this kind of a task, you don't need summarization because there is nothing to summarize. So it depends according to the task, what the task is, what you are speaking, and please develop this habit of speaking continuously like the way I'm speaking right now. You should be in a habit of speaking because sometimes examiner would be very reluctant. In this case, obviously, he would be aggressive, so he cannot be reluctant, but it depends upon task to task. Sometimes a task like a patient is in the end stage, like cancer, then he would be like very quiet. Oh, nurse, I'm really quiet. So at this moment, in these kind of role plays, it is very important to have a loud noise. Loud doesn't mean that loud, but have to have a fluent noise. When patient will say, oh, nurse, I'm really upset. I feel like dying. So you say, please do not think like that. You don't have to feel upset. And I know you are in a very tough situation and you are getting through a very tough phase of your life. And as you have been diagnosed with end stage cancer, so obviously I can feel for you. But don't worry, we will try to provide you the best services. And I assure you that we will use the most advanced techniques to help you. So these kind of things will really help you a lot. I hope you all have understood. Please listen to this role play 2 times, 3 times. Don't leave it for once. In one, you know nothing. Rather, you should take a notebook, should take a pencil, and when I am speaking one line, you should pause it. Then you should write the line. Then you should write it 2, 3 times so that you can remember the lines. At last, OET speaking is going to be the same. Suppose if the patient would have come with a migraine, and then also you will say, don't worry, calm down, relax, we are here to help you, there is nothing to worry, we assure you for the best services, we all are here to help you. So these are the common lines. In OET you do not have too much of lines. So OET speaking is not difficult at all unless you make it difficult by not speaking nicely. The way I am speaking to you right now, the way you should speak to the patient, that should be the adequate noise, adequate volume, and the fluency should be like this. Not exactly like this, but you cannot be slow, because right now you can watch me. Suppose if I, kind of this, if I make my video invisible, then you will understand that it is only the noise which is most important. So if I make a noise like this, don't worry, you will be fine, there is nothing to worry, then he will not pass you. If you would have been a video, if there would have been a video recording, maybe you would have passed, there is nothing to worry, we are here for you. But when there is no video recording like this, that is what is going, audio recording will go to interlocutor. That means the person who is standing, who is sitting in front of you, who is taking your role play, has no marks. So even if he says you have done absolutely well, even if he says you have done something wrong, it will not make a difference, because at the end of the day, audio recording will be heard by two different assessors and they will give you marks. The person who is sitting in front of you is just a patient. So please treat him like a patient. Don't take him as an examiner. This is the most important tip of OET speaking. He is just a patient. Don't ask him at the end, how was my role play? How was this? There is no use of it. And also just take him as the patient and try to make him understand. Please understand, please cooperate, we are doing anything, everything for your benefit. See, if you want a better treatment, you need to cooperate with us, you need to understand, you need to follow our plans. So you need to, you should. These are the common things about OET speaking. And when you ask questions like, do you smoke, do you drink, so do becomes the most important thing. So while asking questions, do becomes the, do you drink, do you do exercise, do you smoke, how much do you smoke, how many cigarettes do you smoke, how much do you drink. So these are the things. Otherwise it will be, you need to, you should, please calm down, cooperate, relax. These are the things when it comes to OET speaking. Again, OET speaking is not covering all the points. Even if I have missed one of the points from the role play, still there will not be any marks deduction. Even if I miss one of the points, the points I'm talking about is this. Even if I miss one of the points, there will be no reduction of marks. But if I do not speak well, if I do not gel up with the patient well. Suppose if patient is talking about this thing, please review my patient, and I am talking about intoxication, obviously the marks would be deducted. So the major reason why people fail in OET speaking, if they fail, otherwise OET speaking is very easy, but why major people if they are failing, there are two common things. One, the noise is not like that, means they are unable to speak continuously, they are unable to handle the patient in a nice way. And the second and the most important reason is that you do not answer the patient. Sometimes you people take the role play first, second, third point. It is not important. What patient is asking, to reply him in a nice way is the most important thing. So listening is also a part of speaking, that you listen to the patient well. First of all, you address his or her problem, then you go ahead with other points. So it is not the sequential point that you need to know. You need to satisfy the patient like you do in your own surgery, in your own clinic, in your own hospitals, as you all are nurses and doctors. So this is the most important thing about OET speaking. This is Dr. Bhupesh. Please subscribe our channel if you have not. And please listen to this video 2-3 times. Keep a notebook and a pencil. Write everything what I have said. Try to record different lines. And this is how you become a professional of OET speaking. Thank you.